If you're having neck pain, I need you to just stop stretching it and start doing this instead. If you're getting neck pain from sitting at your desk a lot and looking a lot like this guy, stretching it isn't gonna fix it. What the problem is it's an alignment issue and a posture problem. And when we talk about posture, a lot of people end up doing this, but when I retract my shoulders back like this and try and think about this, my neck gets away. I have a solution for that. Posture is a physical representation of our internal and external cues from our environment. So if I need to feel what the right position is, I need to change the input. So instead of stretching my muscles and taking the tone away, we probably just might need to strengthen them. So very simply, we're gonna take a band, and we can do this sitting at our desk, standing, or we can do it in quadruped. You're gonna take a band, you're gonna put it around the little bump on the back of your skull, and when I'm in this position, there's very little tension, if any at all. I'm going to push, so I'm going to protract my shoulders, which in turn I have to retract my neck. So being in this position, I can now add some rotation. So what I'm working on is I'm working on the deep muscles in the back of my neck as well as the deep muscles on the front of my neck, and I'm connecting it with the scapula. So I'm pushing forward, and at the same time I'm pushing back with my neck exactly where we need to be. So it's kind of the opposite of this. Well, what if I did that exercise and it didn't change anything and it still feels the same? No problem. We're just gonna move over to the wall and do the scap retraction exercise. So I'm still getting my neck retraction, that lower and upper neck flexion. I'm gonna pin my spine to the wall, and I'm gonna slide my arms up and down. I'm gonna hit that top position. I'm gonna give my head a little bit of a turn to teach my upper traps they don't need to be involved with this exercise. I'm gonna hit this for 10, 12, 15 reps. Until you can feel the muscles working, then your brain can find them and start using them properly. Or if you're really not sure, you can combine the two exercises. I can slide up, come on down, pin my head on top of that band, do some protraction, retractions, add a little bit of rotation. Come on back, pin the arms, slide them up with a breath, come on down, here. Now, quite frequently, there is a lumbar spine component to this where the neck and the back aren't communicating. So we'll get clients to go into that same protracted, retracted position, set the core, and add a hip extension, just to incorporate the lower back. Now, how do we know that we need to do this exercise? Well, in the AMT system, we teach what's called kinetic muscle testing, and we muscle test the neck muscles with the lumbar spine, cross cord reflexes, and all this other fancy stuff to find out what exercise do I need to do and streamline what is best for my clients. Head on over to the link in my bio or to tomswells.com to find out about more information on the AMT system.